Another good piece of work here. This really does show that a really well-crafted amendment. This was done before I came here, but James' predecessor, Dr. Coburn, passed this requiring this duplication report, and it's saved the taxpayer more than $500 billion. It's a real tribute to him and to you for implementing this well. I think we should be honest. I mean, why do we have so much duplication? Well, it's because Congress passes way too many laws, and we don't exercise enough care. Again, you can have this, listing of different programs. I mean, that would obviously be helpful, but there ought to be some type of bird bath, that before you actually pass a piece of legislation or bring it to the floor of the Senate, that it's got to be compared against, what already exists and whether it's going to be duplicating things. It'd be far easier to do it in the front end than trying to do it on the back end. But let's talk about what you've done addressing this on the back end. It's interesting that you've said 74% of what you've highlighted over these 11, is it 12 years now, 11 years?
Yeah. Yeah.
Have been implemented fully or partially. So what I want to do is just kind of go the $500 billion plus. Give us the best examples. I mean, how has that been implemented?
Right.
Again, I appreciate the fact we're passing legislation. That's what I always try to do is make recommendations, come up with a piece of legislation, but that doesn't always pass. I mean,
right.
How are the different ways, almost fighting a guerrilla war here, trying to pare back government? What has been the most effective ways and the number of different ways that you've seen your recommendations actually being implemented?
Yeah, the biggest dollar savings have come from Congress taking action or not taking action. In the case of, we found duplication between the renewable fuel standard and the ethanol tax credit. And Congress let the ethanol tax credit expire. And that saved at least $6–7 billion. There was a program that was supposed to be a temporary program, and some of these things start out as temporary programs for direct payments to farmers that duplicated a lot of other farm programs. So Congress let that program expire, and that was, maybe $40 billion
So
in his case.
With having every piece of legislation have a sunset clause is kind of a good mechanism for
you need a triggering
eliminating
event.
Future duplication.
Yeah, you need a triggering event, and you need to change the incentives. Right now, there's it's incumbent on people like me or others to try to stop a program activity as opposed to the program having to prove they have been effective, they have empirical evidence to show they're effective, and they're deserving of additional funding. So if you had a sunset provision coupled with the burden on the agencies to show that the programs are really effective, then you have a window of opportunity to revisit these programs on a regular, recurring basis, and I think that would be helpful.
I think it's interesting that the first thing you mentioned that's been most effective is for Congress not to act. I think that's interesting. So where Congress has acted or where an agency has acted, give me some good examples of how action actually resulted in reduction in duplication.
Yeah. For example, we found, this is an agency action, we found in the Medicaid program that they're allowed, HHS, CMS is allowed to approve demonstrations, but the demonstrations are supposed to be budget neutral. We found that the demonstrations weren't budget neutral, and so it was costing more money. It wasn't proving to improve program delivery in the Medicaid services. So we encouraged the department, and they have done, as these demonstrations have come up for renewal, not them to allow to carry over money from year to year. That saved probably in the neighborhood of $150 billion right there. Also, we recommended that DOD use best practices for weapons systems development, have business cases up front, require that technology be matured before you go into production. That has slowed down the cost growth in the weapons systems area by well over $100 billion. So those are a couple of the big ones. that we've identified.
Again, those are agencies acting. I mean,
Right.
has Congress actually done something good? I mean, have we been able to pass legislation
Yes,
through
yeah.
either appropriation bills or that's what I'm trying to figure out. What has been
Yeah.
affected when we actually acted?
Yeah, there's, like, for example, we identified once with the military services, we're all developing different combat uniforms. And as opposed to having a uniform set, Congress acted and required the agencies to implement, you know, an approach to developing the new uniforms that would be consistent across DOD.
That'd be through the NDAA then?
And, you know, pardon me?
Was that through the NDAA?
I believe it's either through NDAA or through the appropriations. I'm not
Okay.
sure. I can call it one of the two.
That's fine.
Yeah. And then Congress passed the Weapons Systems Acquisition Reform in 2009 that implemented a lot of our recommendations, and so those have been implemented as well. So Congress has passed a lot of legislative changes that's improved things. They've reinforced in the IT area, for example, the FATARA legislation that passed, Federal Acquisition Technology Reform Act, that you know, emphasized consolidating data centers, which was one of our recommendations. That saved about $6 billion right there. So Congress, I said acting or not acting.
Okay. So my last question, what is the most frustrating example that it's just a piece of low-hanging fruit out there that that should be taken care of, that we should eliminate the duplication that you just have not been able to enact?
One is in the Medicare area. Like if somebody goes in to a doctor's office for an evaluation of a condition, and if you go into an office that's located, affiliated with a hospital, versus going into somebody that's in a private building facility, a doctor is in that facility, you get reimbursed. Medicare reimburses you more for the same service just because it's in a different location. They get more money. To me, that doesn't make sense. There's also...
And that would cost how much to eliminate that or change that?
Well,
Or what would it save?
it would save billions of dollars, yeah. And there's other ones in the Medicare area where they're not adjusting the Medicare Advantage benefits based upon the most recent beneficiary data and characteristics such as race and sex. As a result of that, you know, again, billions of dollars are being reimbursed in the area. The healthcare area has areas that could be a lot of savings.
Thank you for your work. This is, again, a really good guidepost for legislative action, so thank you for what you've done.
Thank you, Senator.
Thank you. Senator Lankford.
Thank you very much. Thanks for allowing me to be a guest on this committee.